All right, Gina, I've been loving our conversation before we hit record. I know that it's going to be great now that we're actually recording. Thank you so much for taking the time today. It's so exciting to chat with you.
Thank you for having me.
Absolutely, absolutely. Okay, so one of the things that I'm an avocado lover. I eat them almost every day. My family does as well. In fact, we just had guacamole last night for Father's Day because I love guacamole. So it's cool to work on a product and with a brand that you love. Um, Tell us a little bit about how you got to where you are right now working with Haas.
Yeah, absolutely. So I am the Senior Director of Marketing and Communications with the House Avocado Board. I oversee the integrated marketing strategy on our nutrition research program. That's really the core of what we do, as well as other industry communications. So the House Avocado Board is actually tasked to promote avocado consumptions. We want to make avocados America's preferred healthy food for every meal. So my job is, along with the other industry members, is to make sure that we drive growth and we increase that per capita consumption. So I'm glad you enjoyed your guacamole last night. Let's keep that up and help us increase our per capita consumption.
I love it. I love it. Well, I know that, there have been so many memorable avocado campaigns that have been run. You and I talked about a couple. I would love it if you would share one of them and we can kind of dive into why it was so successful.
Yeah, absolutely. So as I mentioned before, nutrition research and marketing is a big responsibility of it's the core of what we do. It's and Hab actually started the nutrition research program in 2010, and at the time we didn't really have a marketing platform on how to get that research out. So I was hired in 2012, and my first day was actually a focus group. Um, and we wanted to learn from consumers. How do they, how do they perceive avocados? How do they use it? What are the challenges? What are the barriers? So what we learned from our focus group is that consumers don't just like avocados. They love avocados. But at the time, this was, over a decade ago, they had so many questions. Fat was perceived as a bad thing, right? So, and I think the perception of avocados back then was it has a lot of fat. And so I can't eat like a lot of avocados, and I even went to a conference with dietitians, attending that conference, and some of them didn't even want to eat it themselves, let alone recommend it to their clients. Um, because of the high calories. So there's just a lot of questions back then, like, is it fattening? Am I going to gain weight? Also, like, how do you use it? Because guac is really probably the number one Americans use avocados, but are there like other ways of using avocados? So we have the campaign, Avocados Love One Today, that really that tries to answers all of those questions that consumers have to make sure that they don't feel guilty, when they're eating avocados, and they can indulge, and really understanding the health benefits of that. So we have research, science-backed research focusing on the primary health pillars: heart health, weight management, type 2 diabetes management, and healthy living, which really encompasses a lot of things like gut health, skin health, infant and toddler nutrition, as well as healthy aging. So we've been promoting nutrition messages, along with showcasing recipes, different usage ideas to really help consumers answer these questions. We also work with journalists, reporters that cover health and wellness topics. And, as a result, you may have seen articles on online magazines like Eat This, Not That, Eating Well, Prevention, LA Times recently, we got coverage there, New York Post, really many others that really inform the public of the health benefits of avocados. And just throughout the years, we've also worked with influencers and content creators. But what's funny is actually because over the years people have grown to love avocados so much. There's actually a lot of influencers and content creators that just do it because they love avocados. And their content, because it's avocado related, is getting a lot of engagement because other people love avocados. So I think it's just really interesting how the work has evolved. We also promote our messages to health professionals. And not just any health professionals, obviously, because some of them have a different approach, but we focus on those with food as medicine approach. And a lot of people are familiar with this, but food as medicine is really focusing on what you're eating, the food, the role of food, how it's used to help treat or prevent diseases. So I'll tell you a statistic, a very interesting statistic that you may know or may not know. But only 1 out of 10 Americans meet the recommendations of fruits and vegetable intake. Did you know that?
Wow. I did not know that. And that's like on a daily basis, or is
I
that
mean,
over?
that's the CDC. Like in general, like people should be
Wow.
eating daily, 2 cups of fruits, 3 cups of vegetables. In more or less 5 cups of fruits and vegetable. And yeah, only 1 of 10 Americans meet that recommendation, that daily intake. So unfortunately, most Americans, don't see a health professional until something happens to them, right? So,
Yep.
so really by informing those who work in that space and providing them with that science and resources like handouts that they can give out to their patients and clients, and then providing them with like recipe, food inspiration, usage ideas. We hope that they can better help their patients and clients to eat healthier, and really, when they're talking about food, remembering to incorporate avocados as part of that healthy eating pattern.
I think it's so interesting, Gina, because there is this like you have this unique problem, which is everybody already loves avocados, and then they're asking questions about the health efficacy of it as a product. I know that they're exceptionally healthy, like they're so good for you, and they're not just good for you, they also taste delicious. What a good bonus.
Right.
Um, why do you think it is that people have that disconnect where there's like this confusion about avocados that grow from the earth and have been eaten for so many thousands of years, and it's just like a natural enduring part of the globe. Why is there a disconnect there, and what are some of the appropriate tactics that you took to actually make that education available to people?
Again, I think it's the perception of how we've been told that fats have been bad for you, right?
Right.
So in the past, like I know other packaged goods were labeled low fat, but then they added sugar to it, right, to taste good, because once you
Right.
take out the fat, so I think like throughout the years we've been trying to educate to the public that the not all fats are created equal, right?
Right.
I think there's this again, perception, understanding that all fats are bad. Well, guess what? Actually, all fats are not bad.
That's
And
right.
I think nowadays, like, this, I'm talking about like, you know, 13 years ago, right? When I just first started. And now we're, over a decade later. And I think we've been able to invest in a lot of like, you know, um, marketing and communications programs to make sure that, you know, Americans are well aware of the health benefits of avocados. And not just thinking that they're just healthy, right? Because I think if you ask anybody on the street, they will say that, yeah, of course avocados are healthy. But when you think about like, why do you think they're healthy? I think besides good fats, I'm not sure if they can actually articulate like why they're good for you. I think sometimes they will start saying things like, "Oh yeah, the protein, the omega-3, all these things."
Right.
But when you're, you know, when you're looking at like when you visit your doctor and your doctor tells you like, "Hey, your LDL is pretty high there. Your triglycerides level are pretty high." So, what foods you start searching for treatments. You start searching for solutions. And you learned about like what good fats do. And I think more and more Americans are now understanding that. We still have a long ways to go.
Yeah.
But again, eating avocados doesn't necessarily mean you're going to gain weight. We actually have
Right.
studies that your weight is actually maintained. When you're eating avocados. And there's fiber that makes you feel full, right? When you're eating like
Totally.
nutrient dense foods, with fiber, you feel full longer, so you're not snacking chips in between meals, right?
That's right.
And so I think like again, perception of like, oh yeah, I'm afraid to eat avocados because I'm gonna gain weight. Well, let's learn more about that, and that's what Avocados Love One Today is. If you go to the website loveonetoday.com, we actually have a lot of resources, that consumers, there's a lot of articles, recipes that consumers can learn about the benefits of avocados. We also have handouts, for clients and patients, for the health professionals who are interested. Tons of information there.
How much of your energy and efforts is going towards educating the public at large versus educating healthcare professionals? Because there's two approaches there. They're very different, and they both have different outcomes in how you do that. So how do you kind of split up your energy, effort, and budget to really hit those two different audiences?
Yeah, that's a great question. So the Has Avocado Board actually focuses more on targeting the health professionals. We do put more time, energy, effort, in budget into educating the health professionals. Again, just because the research that we do, that's the kind of science that we want health professionals to understand. Without the science, they can't really back up their recommendations, with their patients and clients. So we provide that for them, and I think it's just best suited, for that type of information is best suited for your health professionals, especially related to heart health, weight management, type 2 diabetes. Those are the things that people come to their doctors for, right? So with the consumers, we do work mostly, like I mentioned before, with reporters. So it's more on the public relations, um, and educating them about the health benefits and different ways to use avocados, as well as our social media, which is social media is a mix of consumers, as well as there's also like registered dietitians, and different health professionals in there. So we have member organizations, that promote their countries of origin. So avocados from
Yep.
Mexico, California avocados, etc. And they do a lot more with consumers. They promote their brand, which is their country of origin, to consumers. So,
I
again,
love
we're
that.
spending more on health professionals, but the industry in general focus a lot on the consumers.
I'm assuming that this push to health professionals is really so that you get the downstream effect of somebody goes in, they're having concerns about their health. A health professional can say something like, Hey, listen, are you eating enough fruits and vegetables every day? Because you probably aren't. You have a 90% chance of not getting enough. So are you? Oh, you aren't? Okay, so great. So did you know like that actually there are healthy fats and avocado is one of the best on the planet and it's actually going to help you out quite a lot in some of the things that you're struggling with. Is that kind of the idea that if you reach those professionals, you're really affecting their entire patient pool, which could be thousands of individuals every single year? I mean, is that why that you've taken that approach?
Yeah, I wish all doctors could just do what you what you just did. You know,
I
that
love it.
scenario. I mean, that's exactly what we're trying to do. But unfortunately, we know that time is very limited. You know when you go to the doctor, you probably wait longer in the waiting room than actually talking to your doctor. They you know an average doctor's visit is probably what, like 10 minutes, maybe 15 minutes if you're lucky, right? So another campaign that we have recently, targeting health professionals, is add avocados to the convo. So adding avocados to the conversation, and we learn from health professionals too that they're just limited, with their time. So we want
Yeah.
to make sure that, health professionals keep avocados top of mind. So if within that 10-minute conversation that they have with their patients and they start recommending food to prevent, whatever issue the patient might have, that hopefully like avocados come to mind, because we've been trying to educate them, through our programs and initiatives, and getting them to again understand the research for whatever health issue it is. And maybe, like you said, if it's something that maybe they need more, to eat foods with good fats, then hopefully avocados can come top of mind.
Yeah, I love that. I think that there's so much out there that people are just trying to, whether they're in a large organization or a new startup, there's this desire because it's always about this quarter, it's always about this fiscal year. There's this desire to push, push, push sales. And a lot of times we skip a really important marketing step, which is education. When you kind of think about where the marketing space is in general right now, there's so much that's changing constantly about specific platforms or about the way that a digital platform works, or even how we're charging for things like what it costs to have a billboard or something like that. When it comes to education as a tool in the marketer's toolbox, where do you kind of rank that? I mean, I know that you guys are leveraging it a lot right now, but I think that there's just such a lack of that. Why has that been an approach that just makes so much sense to you? And how can other people do it at an expert level like you guys have been?
Um, so really, if your audience doesn't understand your product, you're not gonna get sales, right? And so, I mean, really, if you don't understand the benefits of a product, then how are you gonna make sales? So I think, like, education, communications, really, on the benefits of whatever product it is that you're trying to sell, is so important, because maybe they don't need, your shoes now, but you keep educating them about, like, what these shoes can do, any foot problems that you may have that these shoes can help resolve, right? And just really, you know putting a lot of investment, on that part of educating your potential user on what this can do multiple times, so high frequency. I think, at some point, that could convert into, a sale, a transaction. In our case, we actually don't sell avocados. We are a research and promotion board. So our job really is to communicate, the research, the health benefits, and really educate the public, and so that they can make informed decisions about what they're eating. Does that answer your
Yeah.
question?
It does. It does. When it comes to educational frequency, because I think that that was such a good little nugget that you threw out there, that the frequency needs to be high enough that people actually remember and retain that information. Do you have a frequency rate that you feel is appropriate for someone before they really understand the messaging that you're trying to get across?
I don't know if I have the perfect formula,
That's
but
okay.
but I think it's definitely more than 5.
Yeah.
So I mean, internally sometimes as in our team, we're creating messages and we're always trying to evolve, like, something new, and just come up with new campaigns, because that campaign we've already done before. But I keep reminding my team that a lot of people probably haven't seen this.
Yeah.
So I think it's okay to keep, like, maybe the word is not the right one, but recycling, the idea, or using the same messages, and until you hit that person, and because it takes a while for them to see that message over and over again. Maybe you annoy them, but maybe you get to the point where maybe you annoy them, but they start probably looking into it, and learn. And it's like, what is this loveonetoday.com? I keep getting ads about it. It's like, oh, it's because I love avocados. Okay, and then I go to the website, and I find things on the website that I can use, right? So
Right.
I think that's you know important. Obviously, if you have um a bigger budget, you can afford
Yep.
the high frequency.
Yeah, I agree. And I think that that's one of the things I love how you answer that, by the way, because like there isn't a perfect formula. And at the same time, there are some good standards. And it's like, okay, you're at least gonna have to show up 5 times. Like you can't show up any less than that, you know?
Yeah.
So I think that there is, there's some wisdom to that in the fact that like it just takes time. I mean, you and I were chatting offline about our families, and anybody that has kids would say, yeah, I have to tell the kids the same thing 100 times. And you may not have to do that with adults, but you certainly have to grab their attention enough. And we are in
Mhm.
this economy that is just attention based. Everybody wants it all the time. And
Mhm.
so, in order to really grab someone's attention, we need to show up multiple times. Well, Gina, I really sincerely appreciate you being on the podcast. Thank you for coming and sharing your wisdom. If people want to check you out or they want to check out Haas Avocados more, where can they go to do that?
So yeah, absolutely. They can go to loveonetoday.com. That's our website. It has tons of recipes, nutrition articles, a lot of information that I think avocado lovers could benefit from. We're also on YouTube, TikTok, Instagram, Facebook, um, and LinkedIn. I'm trying to figure out if I'm missing anything else. I myself I'm also on LinkedIn. So if anyone wants to connect with me, I'm there. It's GWIDJAJA.
Awesome. Perfect. Well, Gina, thank you so much again for being on the podcast, and thank you for running unicorn campaigns.
Thank you for having me.